Hi everyone, my name is Dan Baer. I'm an athletic trainer and faculty member in the West Chester University Department of Sports Medicine. In this video, I want to provide a brief introduction to the world of sports medicine and athletic training. To give a little background on who I am, I've been a faculty member in the sports medicine department at WCU since 2009, teaching a variety of courses within our undergraduate and professional level graduate programs. I'm also an athletic trainer licensed by the Pennsylvania State Board of Medicine. I've provided healthcare to physically active patients working in a variety of sports, but I'm currently an athletic trainer with West Chester University's football team. In addition to those roles, I also coordinate athletic training clinical experiences for our students enrolled in clinical courses. I'll discuss this later, but this is an incredibly valuable aspect of our students' education where they get the opportunity to gain hands-on experience working with athletic trainers and patients at 4 or 5 different clinical rotations in a variety of settings. Lastly, I'm proud to mention that I'm also an alum of the athletic training program at West Chester University. If the information in this video interests you, please visit the WCU Sports Medicine website at wcupa.edu/sportsmed. And to learn more about athletic training as a profession, visit the National Athletic Trainers Association website at nata.org. You can also feel free to contact me or the Sports Medicine Department Chairperson, Dr. Katie Morrison, if you have any questions. In this video, I'm going to define sports medicine and athletic training and briefly explain the process of how to become an athletic trainer. I'll also provide an overview of the athletic training program at West Chester University. Sports medicine is an interdisciplinary subspecialty of medicine which deals with the treatment and preventive care of athletes at all levels. The sports medicine team includes specialty physicians and surgeons, athletic trainers, physical therapists, strength and conditioning personnel, coaches, nutritionists and dietitians, mental health providers, and of course the athlete. The management of sport healthcare is truly a team effort, and it is a unique area of medicine that has many moving parts. Athletic training is a subset of sports medicine. While there are many people involved with the overall healthcare of physically active individuals, athletic trainers are at the forefront of day-to-day patient care, including the evaluation, diagnosis, treatment, and rehabilitation of acute, chronic, and even emergency conditions. According to the National Athletic Trainers Association, ATs are highly qualified, multi-skilled healthcare professionals who collaborate with physicians to provide preventive services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries and medical conditions. Athletic trainers work under the direction of a physician as prescribed by state licensure statutes. Athletic training is a unique profession, but some people still confuse athletic trainers with personal trainers. In reality, these two careers have very little in common. To avoid confusion with other professions, the term trainer should really never be used. Athletic trainers prefer to be called athletic trainers, or ATs, and most ATs will be quick to correct you if you call us trainers. The best way to describe the job of an athletic trainer is through the 5 domains of professional practice. According to the Board of Certification, commonly called the BOC, the 5 domains of athletic training practice include injury and illness prevention and wellness promotion, examination, assessment, and diagnosis, immediate and emergency care, therapeutic intervention, and healthcare administration and professional responsibility. Prevention is critical. This is the first line of defense to allow safe and healthy participation in physical activity. Prevention starts with identifying individual risk factors, conducting pre-participation evaluations and screenings, and knowing athletes' previous medical history or existing injuries and health conditions, such as asthma, allergies, and diabetes. ATs also play a role in educating patients, athletes, coaches, and parents about things like protective equipment, concussions, heat illnesses, and many other aspects of safety and wellness. Additionally, ATs monitor safety and environmental conditions, including playing surface and weather conditions like lightning, heat, and humidity. Unfortunately, not all injuries and illnesses can be prevented, so ATs also rely heavily on evaluation skills. This includes taking a thorough patient history to identify symptoms, mechanism of injury, and any other pertinent information. It also involves observation of common signs of injury and assessment of strength, range of motion, and vital signs, as well as palpation of specific anatomical structures as part of the physical exam. Lastly, ATs apply and interpret a variety of clinical tests to ultimately come up with a diagnosis and create an appropriate individualized plan of care. During athletic participation, athletic trainers are typically the first responders during emergency situations. This requires significant planning and practice in advance in order to prepare for these emergency situations that can arise in any sport or activity. Athletic trainers are trained to respond to a variety of emergencies, such as heat illness, brain injury, spinal cord injury, sudden cardiac arrest, traumatic fractures and dislocations, and many, many others. ATs are also trained to provide basic life support by administering CPR and using an AED. ATs are responsible for providing continued care until the patient can be transferred to another healthcare provider or transported to an emergency facility. After the initial point of contact with the patient, either in an emergency setting or after an evaluation for acute or chronic conditions, athletic trainers use various treatment modalities to manage injuries and provide an optimal environment for healing to take place. This includes manual, electrical, acoustic, and thermal modalities. ATs also prescribe and oversee rehabilitation programs to address deficits in strength, endurance, power, agility, balance, proprioception, and cardiovascular function. During these interventions, athletic trainers constantly evaluate the progress of their patients and adjust their plan of care based on patient outcomes. The final domain of athletic training is healthcare administration and professional responsibility. This involves overseeing sports medicine policies and procedures, maintaining thorough and accurate medical documentation, adhering to professional guidelines and standards, and continuing one's education by being a lifelong learner. Athletic training is really a fun career with a lot of opportunities to work in different settings, from high school and college sports to professional sports to performing arts, military, and even factory settings. Athletic trainers can also be found in clinics and physicians' offices. While the traditional role of an athletic trainer is with a sports team or a school, there are many other areas of healthcare for physically active populations where you can find an athletic trainer. If you're interested in a career in athletic training, here's what you need to do. Graduate from an accredited program like the one at West Chester University, which is accredited through the Commission on Accreditation of Athletic Training Education. Beginning in 2022, a master's degree is the minimum educational requirement for an athletic trainer. You must also pass a national certification exam through the Board of Certification, obtain state licensure, which varies depending on the state, and continue your education to maintain your license and certification. WCU has one of the oldest and one of the largest athletic training programs in the country. The program officially began in 1970. At that time, WCU had the first accredited program in Pennsylvania and the fifth accredited program in the country. West Chester has a very strong alumni network, with graduates gaining recognition nationally and internationally within the sports medicine community. With the transition of the athletic training profession to a master's degree as the minimum education requirement, we've carried the rich tradition of athletic training at WCU into our Master of Science degree in athletic training. There are two different points of entry for the MS in athletic training. Undergraduate students can enroll in the Bachelor of Science program in Health Sciences with a concentration in Sports Medicine Sciences, or they can enter the MSAT program after earning a bachelor's degree in another area of study. The BS in Health Sciences with a concentration in Sports Medicine Studies, sometimes called the 3+2 program, is a carefully planned curriculum that prepares students for entry into the MS program after only 3 years of undergraduate studies. This program includes a variety of sports medicine courses and prerequisites for the MS program. To enter the MS program, students must earn a C or better in the core coursework and maintain a cumulative GPA of 3.0. One of the obvious benefits of this program is that students are able to earn a bachelor's degree and a master's degree in only 5 years. An additional benefit is that 12 credits of coursework count towards both the graduate and the undergraduate requirements. This is especially helpful from a financial standpoint because students in the 3+2 program pay for these credits at an undergraduate tuition rate, which is less expensive than the graduate tuition rate. The other option for students interested in a career in athletic training is to enter the MS program after completing a traditional 4-year bachelor's degree. Some of our students come from other undergraduate programs at WCU, while others have completed their bachelor's degrees at various colleges and universities around the country. Students from both tracks can continue on into the MSAT program. This program begins in the summer with students taking courses in human cadaver anatomy, prevention and care of athletic injury and illness, and orthopedic assessment. These foundational courses prepare students to begin their first athletic training clinical rotation starting in the fall semester. Additional coursework throughout the curriculum focuses on rehabilitation, evidence-based practice, therapeutic interventions, general medical evaluation, and sport physiology, just to name a few. Students also complete 5 clinical rotations where they work with athletic trainers in a variety of settings to gain real-world experience working with physically active patients. Each student's clinical assignments are individualized and designed to expose students to a variety of injuries, illnesses, work settings, and a diverse patient population. Possible clinical sites include local high schools, colleges at the Division I, II, and III level, professional sports teams, physical therapy clinics, and orthopedic clinics. And the number and type of clinical sites available continues to expand. Again, if you're interested in a career in athletic training, visit wcupa.edu/sportsmed, nata.org, or contact the Sports Medicine Department Chairperson, Dr. Katie Morrison, to discuss enrollment. To apply for the Master of Science program in athletic training, click on the AT-CAS icon on the WCU Sports Medicine website to access the athletic training centralized application.